Today in This Week in Wellness, we meet a local woman who is having success at reversing type 2 diabetes thanks to the experts at Living Health Integrative Medicine. Now, she has a special message for anyone who is working to manage the disease.
Hi, Miss Nobles. How are you doing today?
Lucinda Maria Nobles has been living with type 2 diabetes for over 15 years. And over time, she found the condition increasingly hard to manage.
I remember quite clearly for all of the years that I felt frustrated, I felt angry, and I just did everything I could and took all the medicines, went to the doctors and things like that, but it just wasn't working.
Along with diet and exercise, Lucinda looked for a different type of treatment, hoping to achieve a better quality of life. Then one day, something on TV caught her attention.
And I just happened to be home from work that day, and I saw them, and I said I was going to follow up.
She saw Doctors Tom and Stephanie Chaney of Living Health Integrative Medicine right here on Great Day, Washington. The Cheneys explained how they help a lot of people actually reverse type 2 diabetes. So when it comes to diabetes, we hear a lot of taking care of it before when they're pre-diabetic to diabetic. But of course, that's not always the case.
Well, the issue is that in the standard system, the person who gets diagnosed with prediabetes is really just a wait and watch situation, and they may get told to lose weight or maybe try changing their diet, maybe exercise a little bit more, but they're never really given any clear path or indication as to what to do to reverse the prediabetes. So ultimately, the prediabetes eventually becomes diabetes. And then after the diabetes diagnosis, a medication is prescribed, and they may get told the same thing again: change your diet, lose weight, try to exercise. And so the patient is trying these things. They may be compliant and taking their medication and walking every day. This is where, for example, Ms. Noble was. She tried everything for 15 years, trying to just manage the diabetes, not even necessarily with the hopes of reversing it.
Doctors Tom and Steph Chaney say usually when the patients first arrive, they're often very advanced in the condition with high hemoglobin A1C levels.
And it's not uncommon for people to be on anywhere from 6 to 10 to 12 different prescriptions per day by the time they come to see us.
Dr. Tom, why is your program different and how is it so successful?
Yeah, so that's a great question. So many patients come in and they've been told the same advice. And so what we do is we take a customized approach. So we look at the individual and say, okay, what is all the causes of this disease for them? And we dig into that, and then we start to work on correcting those causes, getting the body functioning better. As we get the body functioning better, we start to see the numbers, they come down. We see the A1C come down, we see glucose come down, we see that they have more energy, we see all of these improvements in their health.
Lucinda attended a diabetes solution seminar with Living Health Integrative Medicine, got a personal consultation, and began treatment with the doctors. So what were your numbers before you started on the program compared to now?
It went from 9.4, and I'm very proud and very happy to say, to 6.1. That is unheard of.
And that is typical of a good candidate for our program. So usually around the 3 to 6 month mark is where we start seeing significant changes. And that first blood test, which happens at about 2 to 3 months, is when we see these big drops of 3 points, 4 points in people's hemoglobin A1C, especially those that are compliant with the protocols that we give them.
But at the same time, while I went through that and saw those numbers and saw the different reports that were being done and the blood tests that were being done, I shared that information with my primary physician too. And I encourage anyone to do the same thing. And I went on a Mediterranean cruise in the middle of all of this. And I saw all of that food out there, and I said, you know what? I know exactly what to eat and enjoy myself, have a wonderful time, and still be able to not gain an ounce of weight. As a matter of fact, I've lost 10 pounds.
Lucinda says her energy level is at a sustained high, which is allowing her to work more closely on her new business ventures.
And I want people to know that there is hope. There is a real way to do this. This is the better way to be able to lower and control and reverse your diabetes. My goal now is to go back to my doctor and to be able to be weaned off the diabetes medicine.
The Cheneys have their own special goal as well.
Our goal is to help at least 1 million diabetics reverse their disease by the year 2020.
Now, the solution to your suffering, just a phone call away. If you'd like to see if you qualify for the Type 2 Diabetes Solution Seminar, call 888-514-4771 or visit diabetesreversalseminar.com. The next seminars are December 12th, 6 p.m. at the Courtyard Marriott, Annapolis, and December 15th, 10 a.m. at the Largo Doubletree Hotel. Attendees will also get a free book called Defeat Diabetes.